It's my pleasure actually right now to introduce to you our final speaker before we take our second break. It's someone who is going to tell you about how our sense of smell is linked to memory based upon his research. Michael Leon is Professor Emeritus at the Department of Neurobiology and Behavior at UCI. He received his PhD from the University of Chicago and joined the professoriate at age 24. He's received numerous awards, including Professor of the Year, the Research Scientist Development Award from the National Institute of Mental Health, and the Healthcare Technology Acceleration Award from the California Healthcare Foundation. Now, just in case you thought I was introducing an underachiever, he is ranked by Stanford in being the top 2% of the scientists in the world. Ladies and gentlemen, Dr. Michael Leon.
So we all want the same things in a treatment for Alzheimer's disease. We want it to be highly effective. We want it to be completely safe. We want it to be affordable. And we want it to be convenient to get. And of course, the most recent drugs that have come out are completely ineffective, dangerous, very expensive, and hard to get. You have to go to the hospital and get infusions. It's not going in the right direction. So maybe if we look in a different direction, we can get some insights into what might help. And there's a fascinating phenomenon called cognitive reserve. Cognitive reserve occurs when people have all the hallmarks in their brain of Alzheimer's disease, all the plaques and tangles, but they don't have memory loss. So they have the disease, but they don't have the symptoms. Some of you may have had tested positive for COVID, but no symptoms. Same thing for these guys. And the reason that they have it is that these folks have had a great life. They've had a great deal of stimulation in their lives. They've had a high level of education. They've had a cognitively challenging career, and they've had a lot of social interactions. And so they're protected from the depredations of Alzheimer's disease because they've had a great deal of environmental enrichment. So it would be great if we could figure out how to get people to not have the disorder symptoms even if they have the disorder, right? So there's a great model of this in the animal world that we use in the laboratory. So most laboratory animals are kept alone in these box cages, not much stimulation at all, but they seem okay. Their brains work, they have learning and memory, they have motor skills, they have social interactions. All of that's great. The problem is that they're deprived. Their brain is deprived and their behavior is deprived. But if you put them in a large cage with a bunch of friends and many new things to do every day, their brain gets much more complex, much more capable, and they are learning better, they're remembering better, they have better motor skills and all that. Even more impressive is that scientists can make lab animal models of human neurological disorders. And these disorders are great because these animals actually have human-like neurological symptoms. And it turns out that you can see all of these symptoms when the animals are in a restricted environment, low levels of stimulation. But when you put them in the enriched environment, they lose many or all of these problems. Here's a list of some of the things that have gone in this direction. And it turns out that if you had a pill that would solve all these problems, it would be a miracle drug. But putting them in an enriched environment is a miracle drug. The problem is that nobody has used it to deal with human problems, right? Because everybody in Orange County thinks that they have so much stimulation, they're overstimulated. But as I'll show you, I think we're deprived of a particular kind of stimulation that turns out to be critical. You can also see this to some degree in the orphans that were generated in a dictator in Romania whose name was Ceausescu, who decided that his country needed more people, and he would get that by stopping all contraception, and so there were a lot of children born, and of course this is something that wouldn't shock you. The economy also went into the tubes, so a lot of poor people had a lot of babies. They sent them off to the state-run orphanages, and you can see them here in their standard cages. They got very little interaction, very low levels of stimulation, and instead of 1 to 2% having autism in the regular population, 33% had autism-like symptoms, right? So low level of stimulation, high expression of symptoms, right? But they took a bunch of them and they gave them to high-quality foster care. These people were paid full-time to take care of them. So a high level of stimulation, in that case, the symptoms greatly diminished, right? So we have a situation here where perhaps we can take children with autism in Orange County and give them the kind of stimulation to increase the stimulation that goes to their brain. Maybe that would help them. And so we did just that. My great fear. Okay. This is a boy getting the kind of stimulation that we gave them. The parents did this 15 minutes in the morning, 15 minutes in the evening, and they did much better. 42% of them had 42% of the stimulated ones had a major improvement in their symptoms compared to 7% in standard care. Let's see if we can, sorry, you can see them doing here. We focused on olfactory stimulation. We'll talk about that more.
And this is...
And it turns out that it's effective for social behavior, which is a core symptom of autism. You can see this boy before he got any kind of additional stimulation.
Hi, nice to meet you. My name's Dr. Ham. Can you shake my hand? Oh, okay. Do you know what we're going to do today? No? I'm gonna ask you some questions. We're gonna do some puzzles and some games, okay? Are you scared? It shouldn't be too scary. Let me show you what we're gonna do, okay?
Okay, so you don't have to be an expert to see that he has social interaction problems. Here he is after 6 months on this environmental enrichment therapy.
Silly.
How about this?
It's a penguin.
These?
Those aren't bugs.
How about these?
A starfish. Those are some clothes.
Good.
That's tired. That is a big bridge.
Okay, so as I said before, 42% had a major improvement of that type compared to 7% in standard care. And 7%, the standard care in Orange County can be quite intense. They also had an improvement of over 8 points on their IQ. Again, something you don't see very often and nothing in standard care. We have a lot more data on them. Their associated symptoms, in addition to the core symptoms, can be as bothersome as all of the other symptoms. So problems with eating, sleeping, mood, all of these things, all improve when you give them environmental enrichment. It turns out that, as you would expect from the wide range of neurological problems that environmental can deal with effectively in animals, you can predict that it might work in the same way for humans. So not just autism, but maybe other developmental problems. Here's a boy who has had ADHD and depression, taking uppers and downers. He had a difficult life. Tell us how you felt a few months ago.
Bad, like upset, depressed, not good, not happy. Like everybody's against me all the time. A black world. It was a black world. That's it.
And were you taking medications?
Yes. And I couldn't eat, I couldn't sleep, I couldn't do anything.
How did the
Study.
medications make you feel?
Bad. It was the medications. But without the medications, nobody could be around me. So it was or that or that.
And how do you feel now?
I feel good. It feels great because I can do pretty much everything except things that I can't do. But
Are you depressed anymore?
no, absolutely not. I'm just,
Are you calm now?
yeah.
Can you sit still and work?
Yeah, because before that, without any medications or mendability program, I was like that. And now I'm not. I mean, it works like magic, this program, and it's just amazing.
So it's been commercialized, it's available, people use it all over the world, called mendability, and the American Psychological Association thought that was a good deal and gave us that nice award for that work. All right. It turns out that the animals, the lab animals, don't need this whole environmental enrichment thing. They can get the same kinds of benefit with just olfactory enrichment. Olfactory enrichment is having many odors every day, right? You can take old lab mice who have memory problems and give them this kind of stimulation, and their memory improves, and the production of new neurons actually improves. And so it may be possible to treat people with just the olfactory enrichment. And the reason that we think it works so well is that the olfactory or odor sensing system is the only neurological sensing system that has a direct projection to the memory centers of your brain. All of the other senses, vision, auditory, taste, all of them go through the side streets of the brain. And so consequently, they have much less impact on anything that goes on in the brain, including memory, right? And so the olfactory system may be critical for the maintenance of the health of your brain, particularly the memory centers of your brain. All right? The problem, of course, is that we don't get enough olfactory stimulation. So, over the course of the morning, you were asked to take deep breaths. Did anybody smell anything? We live in a very clean environment, and unfortunately, our memory systems evolved at a time when there was plenty of odor, right? Nobody ever took a shower, ever. Right? So there was plenty just in your friends and family, but things were going on all around. So we evolved at a time when it was crucial for everybody to get plenty of olfactory stimulation, and now we get very little of it. Not only that, but there are many things in our modern environment that actually damage the olfactory system. So you bang your head, childhood maltreatment, stress, nasal pathway blockage, even chronic sinusitis, stuffed nose will do this. Air pollution, toxins, alcohol, wide range of medications, and of course everybody's favorite, COVID-19. Right? All of these things not only damage the olfactory ability, but they also result in impaired memory. Right? So that's our first hint. Right? All of them trigger memory loss. All right. So how does this relate to Alzheimer's disease? Well, olfactory loss is the first symptom of Alzheimer's disease, and the olfactory superhighway is the first part of the brain to go south in Alzheimer's disease. All right? And COVID really affected that system because months after people had recovered from mild COVID, they still had damage to their olfactory superhighway, and they still had memory problems. And consequently, and perhaps not surprisingly, the pandemic greatly increased the number of Alzheimer's patients. Now, maybe it's not all because of olfactory loss. There's all kinds of things going on in their brain, but it certainly is an interesting finding. These things add up over the course of your life, and by the time you reach about 60 years old, your olfactory ability starts to fall off the table, right? But in close association with that, when you hit the age of 60, your memory starts to go south, and it continues to go hand in hand downward for the rest of your life with olfactory loss. All right? And it's not just Alzheimer's disease that's associated with memory loss. All forms of dementia are associated with olfactory loss. All of them. You don't have to go through all of them. Not only that, but virtually every neurological and psychiatric disorder is associated with olfactory loss. Alcoholism, ALS, anorexia, anxiety, autism, bipolar disorder, bulimia, all right? All of the things that bother people and are serious neurological, psychiatric problems, all of those are associated with olfactory loss. And it's not just neurological problems, right? The things that are probably going to kill you, heart disease, Crohn's, cancer, hypertension, kidney disease, liver disease, lung disease, all of these things are associated with olfactory loss. And indeed, I have identified 120 medical disorders, all of them associated with olfactory loss, right? So it may just be coincidental, right? But 120 coincidences is a lot of coincidences. But it's also the case that whenever you block olfactory ability, right? Even chronic sinusitis, a chronic stuffed nose, even in that condition, you get chronic memory loss. Right? Okay, and it should not be a surprise that by middle life, there are now 7 major epidemiological studies showing that your all-cause mortality, that is, whether you live or die for any reason, can be predicted by your ability to smell things. All right, so we know now from a large number of studies that decreasing olfactory stimulation decreases the viability of the memory centers of your brain and decreases memory. The question now is whether increasing it will reverse all of that. All right? And there are now 20 studies showing that it can. I'll just tell you about 3 of them. All right? So these are young adults, healthy young adults who are training to become sommeliers, professional wine tasters. Actually, they're professional wine smellers. And the way that they train is that they sniff dozens of different odors every day for months to be able to learn to identify the odors in fine wine, right? But they're giving themselves a great deal of olfactory enrichment. And when you look at the critical memory centers of your brain, they're greatly increased in size and improved in functionality. So for anybody at any age, it turns out to be effective in helping your memory centers improve. All right, we did a study in which we took healthy older adults and gave them olfactory stimulation while they were sleeping. We wanted to get maximal compliance. If you ask people to do anything, they won't do it. But if they're going to go to sleep anyhow, they'll breathe. Right? And we found a 226% improvement relative to controls in their memory. That's by far the largest improvement in memory in this population that anyone has ever seen. So that's great. We also saw just a remarkably similar response in a critical memory pathway in the brain. Okay. An even more impressive study came out of South Korea. They took demented older adults and gave them olfactory enrichment. And on 5 standard memory tests, their improvements were up to 300%. which is a mile better than anything that anybody is using for Alzheimer's disease. Olfactory enrichment is now the most effective treatment for Alzheimer's disease, right? And so it's highly effective, completely safe, very affordable. There's just one problem. It's not convenient to get. And the reason is that in order to get these outcomes, they used 40 odorants twice a day, right? Nobody's going to do that, particularly if they have serious memory problems. Right? That 39 or 42, right? So that's not going to happen. So we formed a new company. We worked on this for quite a while, and we developed a device that will throw 40 odors at you as you're sleeping, and we think that is going to allow people to do it. You don't even have to press a button. So once a month, you put in our cartridge, and it comes on automatically as you're sleeping, gives you the olfactory stimulation that your brain needs, and we think it's called memory air. And all right, so we think what we're doing with olfactory enrichment is that we're mimicking a lifetime of intellectual stimulation just with olfactory stimulation, because all the intellectual stimulation is going through the side streets of the brain, right? By going into the superhighway that connects the olfactory system to your memory centers, we are able, I think, to short circuit that system and directly stimulate the memory pathway, and that's why it's so effective. Right? Now, a really interesting possibility is that this could have larger implications for medical care. So how does it work? What's the mechanism, right? We think it's a causal mechanism, right? Because if you decrease the olfactory stimulation in, the memory centers go down, and it's a predictive relationship, right? The worse the olfactory system, the worse the memory or the lifespan. It'd be great to know what the mechanism is, and we think we have a good idea what it might be. Of the 120 olfactory deprived or olfactory loss in medical disorders, 118 of them are associated in addition with inflammation. Guess what smelling pleasant odors do to inflammation? They decrease it, right? So if you can decrease inflammation at any stage of your life, simply by getting this olfactory stimulation, it may be the case that everybody in our modern affluent world needs this kind of stimulation throughout their lives. And maybe we can prevent the onset of the symptoms of many of those disorders that I've described simply by decreasing inflammation, by giving ourselves continual chronic olfactory stimulation that decreases the inflammation. And so if we can do that, we can shift the model from a treatment to a prevention. And if we can do that, maybe we can transform healthcare. Thank you.